Hi, this is your Houston chiropractor, Dr. Gregory Johnson. And I have a favorite patient here named Ovi that we have in here because he has severe lower back pain and pelvic pain that was interfering with his daily life. He couldn't function properly anymore, so he called us, and I'm going to show you how we're fixing him. So Ovi, let's have you go ahead and lay on your back right here for me first. The very first thing that we did after we got x-rays and MRI on his spine, slide you down a little bit more, and ruled out any pathology, was that he had severe degenerative disc disease down at L4 and L5, which is right at the base of his spine. So, once we found that information out, we knew exactly what to do on him treatment-wise, which was decompressing him manually on this spinal decompression device called the inertial extensilizer. Not only does he have degenerative disc in his spine, but he also has degenerative disc in his cervical spine and a loss of the normal cervical curve, which causes that curve to change, and then that stretches the spinal cord to where it hurts and causes forward head posture. That aggravates the lower back symptoms and condition even more. So, very first thing we're going to do is pin his pelvis in on both sides, right at the very top of his pelvic bones, and we're going to lock him in place. And you got to do this really tight, and he loves this part, don't you, Obi?
Oh,
yeah. Everybody loves this. Now you want to make sure, use a wet towel, go ahead and lay your head back. And you want to make sure that they have their mouth closed and their teeth together, and make sure their tongue's not in there so they don't bite it off. And I'm just going to watch his breathing. And then I hit him right at the exact right time. And he felt that all the way down, didn't you, Obi?
Oh, yeah.
Yeah, deep breaths. And look there, he's still kicking, even better. So the very first thing we did was decompress him on the y-axis. Now, while his legs are raised and his paraspinal musculature is relaxed from his low back and pelvis all the way up, we are going to adjust his cervical spine. Just dropping my hand. Okay, now let's tilt right. There we go. And left. Okay. Now, Ovi's condition has been coming on over a number of years. So his condition is called chronic. It's duration over 6 months or more. So now, when we lay him down like this, you're going to notice that I'm going to decompress him not only from his upper part on the y-axis, but all the way down to his ankles. We get his knees, his hips, all the way up into the pelvis. So now, Obi, let's set you up sideways and face towards Renee there. Now, he's also had some shoulder problems here, so just relax this. I'm just going to move your shoulder around, relax it. There you go. There we go. Now, there's only one condition that we have with Obi that we haven't been able to treat, and that's that hard hit. But, but we like having a good time in here. There we go. Excellent. Very good. Now, let's have you come over and lay on your tummy, face down in here. Now, you notice I put the table down so that we can stretch the spine out through here. And he just relaxes his arms there. Next thing I always do is the leg check. Now, his leg's getting better. It was over 3/4 of an inch short when we first started. Now it's only about 1/4 of an inch short. Now, I bring it up, and you can see it actually gets longer. Watch his pelvis twist and raise right there. That tightened up in your lower back right there, didn't it, Obi? Now, see right here, his sacroiliac on the right is out, so I'm adjusting that in the x-axis, the y-axis, and the z-axis, three-dimensionally. Now his sacrum, which is the middle triangular shaped bone in the center, we're driving straight superior to inferior. And then the left sacroiliac joint, you notice I'm adjusting that one differently. And now, here's the degenerated disc at L5, right there. Here's L4, right there. When the vertebrae slip backwards, that's when they pinch on the nerves. Perfect, that's L3. And there's L2. Now, I'm going to put a lateral and oblique stretch, which we got great movement right there, in his lumbar spine, his thoracic spine, as well as his entire rib cage as I do this. See, we get movement all the way up into his upper thoracics. There we go. Now, because Ovi is so tough and because his condition is so chronic, I have to put a great deal of pressure into his hypertonic muscles, which is a lot of people call muscle spasm. And I'm right in the pocket down here between his last lumbar vertebra and his pelvis, and I'm applying a deep, steady pressure on each side. Oh, there's a big knot right there. Yeah. See, he usually cries like a little baby, but he's being tough for this video. No, I'm just kidding. He's tough all the way around. He's a Texans fan, by the way. And we're Texans fans here. And we get, see, he's got really hypertonic muscles right here in his lower thoracics. And usually most people that have degenerative disc disease do have these hypertonic muscles which turn into trigger points, which are basically toxic waste dumps. Because the muscle fibers are so tight, they won't let the blood carry out all the metabolic waste products from normal cellular metabolism. Good. Now one more right here. Yep. I'm going to have you scoot all the way up in there now, Obi. Now, because Obi, now see there, he's exactly even, which is exactly what we're looking for. And see, his pelvis doesn't rock at all. So we got that fixed. He's got a little bit of a knee issue going on there. But now we bring out the big tools called the Terminator. Now he loves this. Now he works with these all day long, only his cuts things, mine beats things. This is our human meat tenderizer. We're going to get in here. And we're going to go all the way up down his paraspinal muscles. This is a retooled jigsaw. There we go. That a friend of mine out in California made. And I'm the only chiropractor in the United States that's worn 3 of them out. And Obi can tell you why. Yeah. So you couldn't really tell it, but he was singing this. Yeah. Very good. Now, here's the big guys right here in the pelvis. You get in and get the gluteus medius, the gluteus maximus, piriformis, tensor fasciolata, or what a lot of people call the IT band. You notice I'm actually putting quite a lot of deep pressure on him. I couldn't do that when we first started treating him. Very good. We're going to check this again to make sure it's exactly even. And now it stays even. So we've balanced not only his structure in his pelvis, but his lumbopelvic musculature. Now, Ovi, I'm going to have you turn on your back for me next. And let's slide you all the way down. A little bit more. Over, I'm going to get your, there we go. Okay, now let's put your arms straight out like this. Now, a lot of people think this is my choke move, but this is actually adjusting the acromioclavicular joint in the shoulder, the clavicle where it attaches to the sternum, and then I adjust the anterior ribs here as well. And we do that bilaterally so that we can, there we go, get all those out of there, and then we just tickle them. So, anyway, very good. Let's have you stand up now, Obi. And how does that feel now compared to when you walked in the door?
Very good.
Very good.
I feel fine.
Great. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.